Hello, and thank you so much for joining us with Exercise Etc. for the webinar, Exercise for the Frail Elder. My name is April Bolter. I am coming to you guys from the Windy City. As you can see, I am up here in Chicago. I am currently working with Loyola University Chicago. I'm the Director of Fitness and Aquatics up there. So if you're ever in the Chicagoland area and are interested in seeing our campus or any of the wonderful construction and recreation centers that we have, I'd be more than happy to work with you to set up a time for you to have a tour. And I'm always happy to meet with anybody. As you can see, what we're going to be talking with today is working within the frail elder. Now, as we start to go, we're going to go through a couple of different areas that we're going to be looking for. So hopefully we're going to give you a lot of information and we're going to give you a lot of useful tools. So what you're going to do, the most important part, of course, is to get your CECs after we're done. You do have to view the complete webinar in order to receive your CEC or continuing education certificate. So after you have viewed the complete webinar, make sure that your printer is turned on or that you have the ability to save the printout sheet to your desktop. So you're going to go and log on to our website at www.exerciseetc.com and then click on the Administration tab over on the left-hand side. You'll see a section for the Webinar on Demand certificate. Once you click on that, it will take you to an area. You do have to fill out all of the required fields and submit that form back. Your continuing education certificate is going to appear on the screen. So you can either save it to your desktop or print it at that time. So if you do not have a working printer, make sure that you save it to the desktop and either email it to yourself or save it for a later printing. Please keep in mind that you do have to view the complete webinar because the WebEx program that we use to record these will track whenever you log on and log off. So if you log off early, fast forward, or delete parts, then it may deny your continuing education certificate. So if you have any questions, please review those instructions, and it should go pretty seamlessly for you to be able to receive your continuing education credit. Now that we are using this Webinar on Demand series, please remember to complete this webinar and print the certificate before December 31st of this year. Certificate with next year's date will not be accepted by your crediting organization. So you need to make sure that you complete this webinar and print the certificate by December 31st of this year. Now what we're going to be looking through today is kind of twofold. We're going to look at an approach of not only working with the frail elder, but also working within their caregiver. By definition, the frail elders, because they're not going to have as much mobility, they're not going to have as much access to get out, they're probably not the population that you're going to see in the gym. So a lot of these tips and techniques that we'll be talking about will probably be utilized in a home-based training situation. And if you're training a caregiver in the home, not only are you training them, but you may also be working with their caregiver, either to help you move your frail elder, or they may be there just so they can learn something. So not only are you working with the caregiver, you may also be educating them, as well as trying to train your frail elder as best as possible. By statistics, if we look at who our caregivers are, 75% of caregivers are female, and 66% of those are married. The average age of these caregivers are 55 years old. So if you think about the ages, most people having children between 25 and 30, that would put the frail elder right around 80 years old. 37% of our caregivers have children or grandchildren who are living at home under the age of 18. And 55% work full-time outside of their caregiver position. So in addition to the caregiver working this full-time, 40-hour per week jobs, they're also spending an average of 20 hours per week on the caregiving for the parents who are living alone. So if you think about how that breaks down, they have a full-time job. 55% of the population of caregivers has a full-time job, and they are also basically picking up a part-time job that they're giving to these caregiving to these parents living at the home. This is going to create a very interesting dynamic, and some of these we're going to break down and look at, not only to help understand about how to work with the frail elder, but also to help understand what it's like to work within a caregiver, so you can see and understand what all the caregivers are facing as well. Now, as we look at this, caregivers, they're underneath so much stress, and this can lead to a number of other illnesses and diseases. So due to the stress of caring for a loved one, our caregivers have a higher rate of hypertension, heart disease, diabetes, metabolic syndrome such as diabetes, and clinical depression. So as we look at these are kind of some really startling things if you begin to think about it, because the stress of taking care of a frail elder is actually going to take a toll on their own health. So if it does this, then think about this. If that caregiver falls ill, who's going to take care of that elder? So with all of these different stressors affecting our caregivers, we want to make sure that we're able to stress to the caregiver that they need to be taking care of themselves as well, making sure that they're eating right, they're visiting their doctor to have their cholesterol checked, that they're having their blood pressure monitored, so that they're aware of what all's going within their own body in order to make sure that they're able to be at the optimal health to take care of this elder. Now, this is a sad statistic, but it is true. When the caregiver predeceases the patient, there is a 45% chance the patient will die within 3 months. Now, that can be due to a couple of other areas. I know that some people have heard die of a broken heart. That may actually be one possibility. Another possibility is they may not be getting the exact same level of care, and their health may slowly decline. So this is a true fact. When the caregiver predeceases a patient, there's a 45% chance that that patient will die within 3 months, which is really startling. Now, as we start to look at our caregiver and look to see exactly what they are handling, you can see a couple of other statistics coming up. If you saw, over 60% of our caregivers were married. So that means they have a spouse on one hand, their children, so they have their own family at home. Then they have the patient, their frail elder, their needs, so seeing that they are under the care of doctors, their insurance is properly handled. Then what happens if they have siblings? That's caught into a rivalry. Whenever they're looking through all of these different things, those bubbles right there are more than a full-time job. Taking care of a spouse, your children, your job, the caregiver, and seeing to all of their needs. Doesn't leave a lot of time for them to have a social outlet, to be able to work with their friends and their community. And that also leads to housework. If you look at just the activities of daily living, housework is one of the larger ones. And devoting so much time to this caregiver role oftentimes is going to take away any bit of free time that they may experience. And that's going to leave the bubbles that are at the bottom of this continuum are going to get neglected. So that caregiver may not have a social outlet. They may not be able to keep up with the housework. And what this does is really going to impact their stress level. It's going to make them higher risk of clinical depression. It's going to put more stress on them. And they're less likely to be able to really focus on themselves, take care of themselves because of everything else that's going on. Now, if you look at all of these different points, what we're going to be looking at is all of the different stressors that can affect our caregivers. The economic stress of being ill. Being ill is more expensive than I ever imagined. If you think about it, it's not only the co-pays, the doctor visits, and the medications. It's also things like taking time off work to make sure that our patient or our elder gets to the doctor's appointment. The gas in the car in order to take the time off work to drive across town, to pick up the patient, drive them to their doctor's appointment, drive back. So it's more than just the medication that they're having to pay for. The cost of health care, the cost of their insurance, all of these things are leading to a lot of stress. And that leads to the time management issue. There's not enough hours in the day. Looking at all of the bubbles that were on the continuum of the last page, if you look at all of those different bubbles, a job takes, we'll say on average, 8 hours a day if they have a standard, 9 to 5 job. So if you have 8 hours in the day, say the average person sleeps 5 hours a day, that right there is 13 hours gone. So that leaves 7 hours to devote to the patient, to their spouse, to their children, to their housework. So there's just so many things that they're going to feel like they're not able to control. And this time management is one of the biggest ones. The health management stress, getting the medications. Is there a generic brand? Can you find a cheaper? Are they willing to give? Is the insurance willing to pay for this? Or is there a large copay? So managing those medications, the Medicare, and the insurance can literally become a full-time job, especially if it's at maybe the end of a benefit or if they've exhausted an insurance policy. So that is something that's going to take a lot of money, a lot of time, and a lot of resources, adding to the stress of our caregiver. And the stress of realizing that mom may never get better or dad may never get better is something that is just, it's very heavy on the heart, it's very heavy on the person, and that leads to that additional stress. And then after the realization of they are never going to get better, or even the worry that they're never going to get better, comes the guilt that if that parent or if that patient dies, that they're the person that's going to be blamed. And that guilt will really become something that's really hard for a person to handle. So we want to make sure that we're understanding not only what our elder is going through, what our patient is going through, but also what our caregiver is going through. One of the worst stressors I've ever seen whenever you're working with an older patient, I had the chance to work with a patient who had had a stroke, and their daughter, the youngest child, was the one who was taking care of them. She really wasn't that old. She was around 41, 42. But she had an older brother. And the older brother constantly never came to the rehabilitation appointments, never came to the therapy, but was always telling her things to say to the therapist, always telling her things to say to the doctors. And this is something that can cause a lot of stress, having the invisible sibling who just can't handle it. I can't stand to see mom this way, therefore I'm not going to be there. So then the sibling that is caring for that elder, it falls completely on their shoulders. The bossy sibling, which was a sibling that we were dealing with. They were invisible because I have to admit I never met the brother, but that was constantly, I was always hearing it from him through this young woman that was having to say, well, my brother told me I need to ask this. My brother said that this needs to happen. So these are things that can really add to that stress. The condescending sibling, you chose this. You're the one who chose to take care of them. You just want to be the hero. You want to take all of the attention. Or the busy sibling who refuses to help. Or the out-of-towner who is just saying from a distance, well, here's what you should do. Always giving advice but never giving support or help. So in addition to having to worry about their own family, their spouse, their children, they're having to worry about their other family, the brothers, the sisters, and I've even actually been able to witness the frail elders, brothers and sisters, being very bossy to the person who was giving the care. And so may not necessarily be a sibling. It may be an aunt or an uncle that is giving you all of this advice, as they call it, or guidance. So these are going to put a lot of stress on other people, and it's going to put a lot of stress on our caregivers. So when we look at this, what we want to make sure is that we're really taking the time out. We want them to understand that they may have a change in family structure, and we need to be supportive and understanding that they may cause a little bit of additional stress for the caregiver that will probably be reflected upon you, the fitness professional. It may have a change in family structure, a change in marital status. The caregiver may have to quit their job, therefore change in economic status, and a change in their living conditions. What if the caregiver has to move in with our patient or move in with the elder? So these are a lot of different situations and scenarios that can really lead to a variety of reactions. There's the unhealthy reactions, such as turning to food for comfort, overeating, overdrinking, or self-medication. These are all our unhealthy reactions. What we want to do is we can make sure to be a positive reinforcement, to let our caregivers know that there are ways to cope with the stress. Going through therapy, support groups, working with yoga, meditation, and really working with that outlet of exercise to begin to feel better and to really be able to see that there is a positive side and a positive way that they can take care of the stress. So as fitness professionals, we can always try to be that positive reinforcement for our caregiver. The reason we go through that is to make sure that everybody understands that it's our care and our focus should be on the elder, but it's nice to have a well-rounded understanding of everything that is going to be affecting this elder. Because if you're walking into someone's home in order to work with them, to have a session with them or training, you're actually, in essence, walking into their family structure. And a lot of elders, a lot of caregivers really become reliant on that social interaction and really become almost reliant on having somebody else to understand what they're going through, since they're coming in the home and seeing the elder and working with that elder or patient. And with that, what we're going to do is we're going to start to look at what all these foundations are. What do we need these caregivers to understand? One, we need them to understand specifically what frailty is. And we need them to understand that in addition to what we're doing, we need them to keep the patient as independent and as possible for as long as possible. We also need them to understand when to ask for help. Sometimes you'll see a caregiver who tries to give too much. They think they can pick up the patient. They can pick up their mom or their dad if they're on a chair, in a bathtub, and then they wind up injuring themselves. So we need them to understand when they need to ask for help, either with other members of the family, maybe bringing in a nurse, bringing in something else in order to really ask for help and recognize their own limitations. And at number 5 goes back to those healthy reactions. Make sure that they're taking care of their own bodies. They're exercising, get plenty of sleep, eating healthy, and trying to stay healthy themselves are some of the biggest fundamentals that we can give them to help them to understand. Now, our main point is that our caregivers need to understand what frail elders specifically are. And what frailty means, it's a combination of both an age-related and or a disease-related change. So frailty is defined or is diagnosed when an older adult exhibits 3 of the following 5 criteria: the unintentional loss of 10 or more pounds in 1 year, general exhaustion, poor grip strength or overall weakness. They go hand in hand. The overall weakness is generally tested by grip strength, a slower walking speed, and a low level of physical activity. Now, as you look through these, you'll notice that some of these are interconnected. A general exhaustion could lead to a lower level of physical activity. Lower level of physical activity could lead to the slower walking speed because they may not be in shape in order to keep up with everyone else. So realize that some of these are going to be interconnected. And also, for all of our people who are working, for all of our fitness professionals who are working with our mid-level, 55, 60-year-old individuals, we need to make sure that they understand that frailty doesn't have to happen. It is something that does not have to come with age, and it can be prevented to a certain degree. So if you're working with your clients or you're working with people within the age range of 55, 65, then help them to understand that not only are they keeping their health, but what they're doing is building a foundation for later in order to keep their independence and maintain that. Now, we do have some effects of frailty, and these are oftentimes immediate. The general decline in health. As you notice, if they've been diagnosed with three of the five criteria, such as a lower level of physical activity, then that could lead to other things such as heart disease. It could lead to things such as a metabolic condition like diabetes or hypo or hyperglycemia. So this is going to offer a general decline in health. Oftentimes that leads to a depression, and that can often, one of the most, I would say, worrisome ideas of our elders living alone is the fact of falls. Now, when we look at this, statistics show that 1/3 of the population over the age of 65 will fall. 1/3 of the population will fall over the age of 65. That's a really scary statistic. And also, if you notice, if you look at the study, and this was done by the Department of Health back in 2006, they found that women are 58% more likely to sustain a non-fatal fall than men. So whenever we start to look at that and look at those statistics of falls, there's something that happens with that, and it goes hand in hand with impaired mobility. Once someone falls or has a near fall, what's going to happen is they may develop a fear of falling, and then they're going to change their activities. They're going to change their steps. They're going to change their gait. And this is all is going to lead to our impaired mobility and could possibly lead to a disability. Now, within all of these different things, the general decline of health, the depression, these can lead to the weight loss and the overall weakness. Those can actually increase the risk for the loss of coordination. So whenever we're looking at all of these different risk factors that happen immediately, what these are pointing to is that the frail elder is facing the threat of no longer being able to live on his or her own. So these are things that we really want to make sure that we can keep an eye out for, and things that we can really make sure that we can help them to understand these can be prevented. Now, there's a couple of medical concerns. As you notice, frailty can be an effect of not only age-related, but also disease-related. And one of the big ones that we'll notice is anorexia. Now, I'm sure that everybody's familiar with anorexia, but the problem with anorexia is not only whenever does it affect their bones as they're going through this anorexia, but it also affects them long-term. And what that happens is those changes in their hormone levels that they sustained while they were suffering from the disease is going to lower their estrogen, lower their thyroid hormones. That's going to increase their stress hormone, and that's going to produce basically an overall loss of bone mass. Sometimes they are able to strengthen their bones, but once they have lost some of that mass, that's going to put them at a higher risk of frailty later on in life, and it's possibly going to affect them earlier than it would have affected them had they not have suffered from anorexia. Another one, our sarcopenia, is the loss of muscle, and generally the loss of muscle and tissue is going to lead to less activity. That's going to lead to immobility, and that's going to be a precursor to an increased risk of falls and injuries. There's a couple of other medical concerns that are going to happen, things like atherosclerosis, impaired balance, depression, and cognitive impairment. Now, when we look at cognitive impairment, And we'll break down some of these different levels, different diseases that can lead to frailty, and cognitive impairment is one of them. Whenever we have patients who are suffering from dementia, they may have a specific weight loss tied to the forgetfulness. Oftentimes, our dementia patients, especially if they do not have close care or a close eye on them, could forget to eat or are not eating the proper nutrition. And therefore, that's going to lead to a weight loss. So there are a number of medical concerns, in addition to the age-related concerns, that we want to make sure that we can understand and that we can help to work through. Now, when we start to talk about treating frailty, the first one that you want to have your clients assess for is depression. And all of these different things can be looked at by a doctor, and I'm sure that many of your elders have already had these. But you want to assess for depression, partly not only to make sure that you can get them on the correct medication to help it, but also so that you have a better understanding of what they're going through. We also would like to have their testosterone levels checked. After mid-40s, a man's testosterone levels are going to decline at the rate of 1% per year, and that starts after the mid-40s. Now, here's a startling statistic. By the age of 80, a man's testosterone level will be equal to that of a prepubescent boy. So if you think about what all testosterone is responsible for, and you realize that with this lack of testosterone, they're probably going to start losing muscle mass. That's going to lead to an overall inactivity. And the loss of muscle mass could also lead to an increased risk of the frailty, or also lead to them being unable to care for themselves. Now, for women, we want to make sure that their thyroid is checked. Now, remember, your thyroid is responsible for converting food into your energy and also for using the required energy to keep your body warm. So low levels of thyroid are going to lead to fatigue, a lower blood sugar, and a slower digestion. So we want to make sure that we are aware of what all is going on within their body. Ways that doctors can combat this, and also your clients can help to be aware of it, is with the supplementation of our B vitamins. We have both B12, B6, and folate is also known as B9. So B12 is involved in the metabolism of fatty acids and the resynthesis. So if we have a low level, if our metabolism is at a low level, so we have a slow metabolism, that's what's going to lead to this fatigue, depression, and it could also lead to a weight gain. B6 is responsible for catabolizing our amino acids, so breaking down all of those amino acids and protein in order to be able to repair our muscle mass, use it for energy if needed, but also to really come in and to help resynthesize the part of the body. And that's where the folate comes in. Oftentimes, people will take folate when they're pregnant because folate is responsible for resynthesizing cells or the cell division. It's really important, specifically when you're pregnant, is it helps the fetus or the baby to develop all of their DNA and RNA as they go through and grow. So whenever they are working with their doctor, there's a number of different things that they can have checked to make sure that we are looking at frailty from a holistic aspect. Now, in order to reverse frailty or to stop frailty in its tracks, it's going to take an entire medical community. And a medical community means a doctor, a dietitian, a fitness professional, and possibly even a mental health professional. They need to have a nutritious diet to make sure that they're getting all of their B vitamins, enough protein, and enough carbohydrates. They need to focus on strength and flexibility and cardio. And then also, we want them to focus on their balance training. The reason we want them to focus on their balance training is to reduce those risks of falls and also for the ability for them to recover if they do stumble so they don't actually fall. Tai Chi is something that's really important. I always make sure that I recommend our frail elders work within Tai Chi. And there was a study that was done by Stephen Wolf, and it was done back in 2009, I believe. And what it did was it took 200 participants who were over the age of 70. And what they did is they did 15 minutes of Tai Chi sessions at home for 2 times a day. So they did 2 daily 15-minute sessions at home. Now, within these 200 participants, half of them were doing Tai Chi at home. The other half were having a straight computerized educational program. So basically what they did was they just listened to lectures, they learned information, but they weren't actually going to the Tai Chi program. What they found is that the Tai Chi group reduced their risk of falls by 45%. The group that underwent the computerized and educational system, those groups only reduced the risk of falling by 8%. So Tai Chi is something that I always try to make sure that I really encourage. And the reason is because it helps them learn how to ground themselves, how to properly stand in order to be balanced. Yoga is a really great addition to their program because what they're going to be focusing on is breathing techniques. They're going to be focusing on moving through the movements and also listening to their own bodies. So these are great tools that we can give them that will really complement the doctor, the nutritionist, and also the mental health professional. Now, as we look at these, there's a number of conditions that can result in frailty. A musculoskeletal disease, possibly a cardiopulmonary disease such as a heart attack. Maybe they're not able to recover from a heart attack or are less likely to engage in physical activity. A neurological disease such as dementia and psychiatric disease, and possibly any other chronic condition such as that arthritis or multiple sclerosis. So there's a number of different things that can happen that can really result in frailty that we want to make sure that we're aware of. As we look through and we look at working within our elder patient, what we want to make our goal is that we make basically our frail elder the most up-to-date activities of daily living, and we make sure that they're able to complete all of these from the basic to the advanced. Now, as you start to look through the list of the basic activities of daily living, things like dressing, putting their arms over their head to put their arms through their shirt. So things like that are something that's going to be difficult because they may have a limited range of motion. Eating, be able to prepare food, moving about the house, and hygiene, taking a shower, getting in and out of the bathtub are things that are really basic. But if you look at it, stepping up and over that bathtub could prove to be really difficult. So our goal when working with our frail elder is to make sure that we keep these ADLs up, that we keep them in charge of these activities of daily living instead of having a caregiver provide these. If you think about toileting, that's something that's really could be difficult. If your knees ache or if you're not very strong, simply coming from that seated position up to a standing position can really cause a lot of pain and a lot of uncertainty. They may feel unsteady. They may not feel like they can get up without holding on to something. So these are things that we really want to focus on keeping them active. And then our advanced daily activities of daily living, such as shopping, housework, writing bills, so they have the mental acuity, the food preparation, and then the transportation. This is what we're going to be looking at whenever we start to look at the progression. We're going to be going from stability to reduce the risk of falling into mobility. How can they more effectively move? How can they work with their range of motion to be able to have the utmost self-care, such as dressing themselves, maybe putting their arms up to wash their hair. And then we're also going to last work on resistance. That way they can carry something, possibly carry food from the stove to the table, or to even put away groceries. So we're going to be looking at all of these different progressions. But first, what we're going to look at or what are the specific guidelines that we want to be aware of and that we want to make sure that we can do the utmost to help our frail elder be successful. The first one that we're going to look at is Alzheimer's. You want to make sure that you can rely on touch when working with our Alzheimer's patients. Eye contact is important because it helps to keep them in that moment. And as long as you can keep a calm and soothing voice tone. Remember that a lot of times our Alzheimer's patients are going to get irritated rather easily. So keeping that calm, soothing voice tone is going to be really important. We also want to keep our tasks both simple and repetitive and limit them to about 15 minutes. There was a study that was done in about 2003, I believe, that showed that regular exercise helped reduce the wandering, the aggression, and the agitation that oftentimes accompanies Alzheimer's disease. So as you start to look within our patient, realize that these activities may be day-to-day. You may come in one day and all of your planned activities may go seamlessly. They may all work. They may be able to complete every task. But the next day, if they're having a bad day or possibly having a bad time, then these tasks may be something. So always remember to keep that calm and soothing tone in order to keep them very calm and in the moment. Now, arthritis is one that's really going to be challenging because oftentimes they feel it hurts too much to actually move through some of the exercises. So always watch the pain response and defer exercise if you have to. Allow them for the adequate warm-up and always start with the range of motion exercises in order to make sure that they're prepared for whatever you're going to be working with. Water exercise, especially in warm water, is exceptionally good for arthritic patients because your body is more buoyant in water, so it's a reduced amount of stress on the joints. So if you have the access or if your client has the access to a warm water aerobics class or even just a senior sitter that keeps the water a little warmer, it may be something that's going to be really, really helpful. Now our COPD, this is one that we want to look for to have the longest warm-up. So always keep the intensity low, give them plenty of time for their breathing to adjust through that long warm-up, and make sure that their inhaler is available. Always avoid the isometric exercises and anything with their weight above their head. So a good rule of thumb is to keep it shoulder level or below. Now remember, as their blood pressure increases, which is what would happen if their arms would go above their head, their breathing is going to get much harder. Whenever we switch through, in a couple of slides here, I believe it's about 3 slides away, we're going to talk about how to breathe freely. And this is something that's really, really important for our COPD patients. Now, when we're working with our stroke victims, realize that not only are we working to keep their activity level up and to work with them on being able to come back from that stroke, but we're also focusing on reducing their risk of a second stroke, which is something that is really, really important because remember, after they have one, their risk for a second is much higher. So we want to make sure that not only are we working on the sides of the body and improving circulation, working with them on their daily living activities, we also want to make sure that we're focused on reducing that risk of a second stroke. Now, as we start to work with hypertension, this is another one that we want to give them a nice, long warm-up to allow their body to prepare for the exercise. Avoid any sudden postural changes, so you don't want them to go from a position maybe on their back on the mat to standing up too quickly. So if you're doing any type of yoga exercises or yoga poses, this is something that you really want to make sure you can focus on to avoid any sudden postural changes. And always observe them for the signs of overexertion. Be very well aware of what your client's limits are, because oftentimes, especially our male clients, will overexert themselves. So you want to make sure as the professional, you're really taking note and keeping an eye on what is best for them. Now with our depression, exercising in the sunshine or bright light will help to reduce the effects of depression, also encouraging that group interaction and that social interaction will be really helpful. If you can possibly have them understand that not only you understand, but also help them to understand that some days they may just be having a bad day, and that anger or frustration is something that you'd like to work through, that exercise can help relieve that anger and frustration. And anytime you can get them outside in the sunshine, we always have a joke at Loyola about absorbing the vitamin D. Since we're within Chicago and it's not always very sunny during the winter, that vitamin D is something that is really, really important whenever we're talking about our overall mental health. Now with joint replacement, oftentimes a hip or knee replacement is something that you're going to see in our older population. We want to make sure that we take them through their pain-free range of motion. Now keep in mind that with that joint replacement, as much as we like to believe it's brand new, it's just like the one that they took out, realize that there still may be a challenge of balance. So while they're still adjusting to maybe an altered movement pattern, they maybe have to need a chair while exercising, while they're rebuilding that strength and balance. The one thing that I always like to stress, and there's a couple of different places I believe that we stress this, is following the guidelines from their surgeon or physical therapist. A lot of times people stop going to their physical therapy before they complete all of their sessions. And we want to make sure that we're not working with them in the capacity of a physical therapist. I cannot tell you how many people I have heard tell our personal trainers, well, I can tell you what my physical therapist and I were doing. Can't you just do that with me? So we want to make sure that they complete all of their physical therapy sessions and are released by both their doctor and their PT in order to take part in working within a fitness professional. Now, osteoporosis goes hand in hand with a lot of our frailty. Oftentimes, that loss of bone mass is something that we're going to really have to focus on. So we want to try to have them do these weight-bearing exercises. But keep in mind, they cannot do any spinal flexion or rotation. And since they do have a lower bone mass, we want to make sure that we can do everything to minimize their risk of falling. Now, this includes doing things such as maybe looking at the site you're going to be working with them before. Also may include, if you're working within the home, to help go through the home and to help them see where potential fall risk may happen. As you look, statistics show that almost all falls happen in the home. So we want to make sure that we can do as much as possible to really help them be prepared for it. Our last few that we're going to be looking for here are going to be Parkinson's, vision loss, and hearing loss. Now, Parkinson's is one that can be also day-to-day. Using those lightweight, having them hold the very light, maybe 1 pound or 3-pound dumbbells, will help to reduce the tremors in the hands, which is the shaking. Lateral swaying with support is going to decrease the musculoskeletal freezing. They say that over half of the patients who are suffering from Parkinson's will experience freezing. And basically what freezing is a very temporary lock of the muscles. But it's something that the first few times they experience it may be really scary. Perhaps if they're about to walk down a long hallway, cross traffic, things like this, if a freeze episode happens during these times, it can be really unsettling. There's a couple of different things that we can do. That lateral swaying will help, but we can also have them work on lifting their toes up with every step. A lot of times Parkinson's patients will have more of a shuffle to them, so they won't necessarily pick their feet up. They'll kind of shuffle along. So we want them to lift their toes up with every step and maintain a wide base of support. So by a wide base, we mean just slightly wider than hip-width apart. Have them practice turning without having to actually cross their leg one over the other one, so that it can work on turning with these steps. And we'll go over a few activities and exercises here in just a moment that will have these turnings in there. Whenever we work with a Parkinson patient that feels a freeze episode coming on, or if their legs feel frozen, have them try to lift those toes up just ever so slightly in their shoes. Don't have them necessarily lift their foot up, but just move their toes up. Oftentimes that will relieve some of the spasms. And also, one thing that we'll focus on in a moment is working on walking in all directions. Our next one is our vision loss. Keep in mind, our elder patients who may be suffering from some loss of vision may have a sensitivity to the light, so these bright lights can hurt their eyes. Always have them understand and rely on touch. So when they go to sit, have them feel for the chair, either with their arms to see where the back of the chair is, and then to have them get used to sitting so the back of their legs feel the chair. With vision loss, this goes back to the osteoporosis of ways to avoid falls. And we do that by avoiding clutter and moving any of the tripping hazards away from the area that we're going to be working with. Hearing loss is one that is probably the most challenging. You want to make sure that you speak in a normal tone and try to lower your voice. I always laugh whenever people say that they have selective hearing, or when older men suddenly can no longer hear their wives. And the reason that that happens is because as they get older, they have the inability to hear the higher tones. So if you can keep your voice lower and really enunciate, it will help them to understand and to follow your instructions a little bit easier. And always keep those background noises to a minimum. Now that we've gone through some of the specific guidelines, things like Parkinson's, vision loss, and also Alzheimer's, what we're going to be looking at is how we can take these and put this into more of a stability training program. Remember, whenever we looked at the progression, the stability training is our first step. What we want to look at first is their breath. We want them to breathe freely and naturally. If they hold their breath, that's going to exacerbate many conditions such as their blood pressure, their hypertension. So we want to make sure that they are always breathing in and out and are really in control. Focus on posture. Whenever you're all slumped over, not only does that weaken your core muscles, but it also inhibits your respiration. So number one thing that we want to focus on is pulling their posture up. Once they have their posture right, they have their posture up, they're going to strengthen their abdominal and core area. And also, we want them to really focus on breathing in through the nose and out through the mouth. Now, the reason we do that, one is to help them to gain control, to strengthen their lungs. But the other reason that we do it is because it warms and moistens the air that they're taking in and out of the body. Something else that I like to have them work with to help them strengthen their lungs is a very controlled breathing. Inhaling for 2 seconds and exhaling for 4. So they inhale 1, 2, exhale 1, 2, 3, and inhale 1, 2, exhale 2, 3, 4. Now some people will realize that the inhale for 2, exhale for 4 may not feel natural to them. So if that happens, work with them finding something that does feel natural, but is still within control, so that they are exhaling longer than they're inhaling. And having them work with enunciating their vowels A, E, I, O, and U will help them to really utilize the abdominal muscles in order to force that breath out. A, E, I, O, and U can be really beneficial when helping them learn to breathe naturally. Now that we have our breath down, we're going to look at a couple of exercises to help work within this stability training. And the first one is our transverse abdominis activator. Now this exercise, if you notice, what our client is doing right here is she has her chair turned sideways and she's up against the wall. She has her arms straight out and her palms pressed together. Her arms are as close to parallel with the floor as she can get. Now, if your client needs to use the back of that chair for support, by all means, allow them to utilize it. But if you possibly can, have them stand up and holding their posture. What you're going to have them do while they're breathing freely and controlled, you're going to have them try to push their arms against the wall. You want to focus on keeping the shoulders and the hips in alignment. So they can't just lean forward over to the wall. Their shoulders and their hips have to stay in that line. You can also do this with a partner variation. So what they can do if you don't have a wall around you, they can sit in a chair. The trainer or their partner can stand facing them and place their hand on one side of their arm. And all you're going to do is apply gentle pressure. And what your client has to do is resist your hands pressing them. So all they have to do is activate that core in order to keep their arms in a straight position directly in front of them, parallel with the floor, as you apply pressure to move it from side to side. Now, what's really great with this specific exercise is it teaches them how to engage their core. And we want to, sometimes it's harder because people do lose a little bit of muscle control as they get older. Muscle memory, once they learn how to do it, it's going to be easier to build it each time. Now, what we're talking about by stabilizing their core is have them think about what they would do if you said, now I'm going to push on your stomach or punch you in the tummy. What would you do? It would automatically tighten that core up. What you want to try to cue them to do is to hold that tighten, almost drawing in their navel, drawing up their pelvic floor, and hold that position while they're still able to breathe. You don't want them to just suck it in and hold their breath. You want them to draw in the navel, draw in the pelvic floor, almost like they're going to stop themselves from peeing. So, and hold that position. And then have them go through this transverse abdominis activator. Give them a little break, and again, have them stabilize their core, drawing in the navel, drawing in the pelvic floor, engaging that pelvic floor, and then have them go through some of the bowel practices while maintaining that position of saying the A, E, I, O, and U. There's a couple of different variations that you can give this exercise without really having to change too much or really having to change a whole lot at all. Our next one is going to utilize a little bit of a prop. Now, instead of this balloon, you can have them use a playground ball, something like a foam playground ball. There's a number of different things that you can utilize that doesn't have to be just a balloon. But what she's doing is she has the balloon placed as close to her abdominals and chest as she can. And it's just she is crunching down and trying to crunch against that ball. Now, be aware of a couple of things. One, the balloon, once they lean forward, may shoot out. So you don't want them to lose their balance and fall out sideways of the chair if something were to happen to that balloon. Also, be aware that the balloon may pop. So if that balloon, if you have somebody, maybe they're not a frail elder and are quite capable, and they press a lot of pressure onto that balloon, that it may pop. So be aware that maybe a playground ball or some sort of ball may be a better alternative. But we will give you a number of balloon variations. Keep in mind, balloons are cheap, easy to transport, so this is something that is really great. Our next one is our balloon back extension. Now, our balloon back extension, what they're doing is, in this picture, our elder is holding onto the chair for support. But what I like to do is to have them hold their arms out into a T and then press back. That way I make sure that they're actually utilizing the correct muscle as opposed to holding onto the chair and pressing back. Again, keep in mind that the balloon may pop or actually just pop out. So there are a couple of different things that may happen within this. If you want a little bit harder of a variation, have them put a set of tubing underneath their feet. They lean forward as far as they can, as close as they can get to get their chest to their knees, grab the tubing, and then just simply come up to an upright position. if they are able to do that, then that's a little bit more of a back extension, a little bit more difficult to add an additional element. Now, I feel like weight shifting is one of the most beneficial exercises that you can do within mobility training. Now, if you look at this weight shifting, our person on the left, what she's doing is she's going forward and back. Now, she's just demonstrating it in a picture. But what I like to do is I like to stand directly in front of the client, and I have my arms out so that if they need help, they can grab onto me at any time. You can also do it with a bar, and they can stand next to a bar to do this. That way, if they need to grab on, they can. What you want them to do is to learn what it feels like to, without moving their feet, to shift all of their weight forward onto the balls of their feet. And then utilizing just the control of their feet to move their weight all the way back. Now, what you're doing is you're having them learn to go through that range of motion. And if you think about it, depending upon the level of frailty that you're working with, I have them lean as far forward as they can before they have to take a step. And the reason I do this is now, not only are we helping them learn where their center of gravity is, now, and if they've had a lot of weight loss or gain, they will notice it being different. We're helping them learn where their center of gravity is, but we're also helping them learn their limitations. We're helping them learn when they need to take that step and what it feels like to utilize their entire foot. Now, I'm not saying to take their shoes off, but oftentimes what shoes do is they support the foot so much that your foot almost loses the tactile senses it has of gripping the floor because that shoe is so supportive. So by working with this weight shifting both forward and back, they're able to regain some of those senses. Also, what we want to have them do, and what our model on the right side is doing, is leaning from left to right. The reason that we have them do from the left to right is because falls don't always happen in a forward-backwards motion. They may step sideways or catch their foot and have to learn how to step a large step to the right in order to catch themselves. So we can have them work with finding their center of gravity and also have them work with moving through the entire base of the foot. Our next exercise is marching. Now, this is actually a couple reasons why this is so important. One, having them in a seated position allows them to be able to be stabilized and comfortable. But when they're seated, they should be able to work on lifting their knee up as much as possible. Now, not only are we strengthening that hip girdle, but also what we're having them do is to work on the strength and confidence of lifting their foot up and lifting their knee up. You can utilize this at different tempos to utilize the cardio benefit from this, which is a great workout. But if you've ever noticed, oftentimes our elder population will change their gait. I noticed this a lot in Chicago because of the snow. Now, when it becomes icy or maybe the sidewalks are covered with snow and someone hasn't shoveled, what happens is they stop picking up their feet as much because they don't want to slip. And if you're in the city of Chicago where winter generally lasts about 5 to 6 months, that's a long time for them to have this altered step. What happens whenever the snow melts? They never change their gait back. So now they have actually changed their mobility. So what we want to do is focus on being able to help them lift those knees up, move from that hip joint, and really focus on being able to increase the strength and the awareness to do this. From this seated position, there's a couple of other exercises that you can do. One is a tummy twist. So as they bring that right knee up, they can rotate over to touch that left elbow to their right knee. Now, keep in mind, this isn't appropriate for all populations. Perhaps someone with osteoporosis is not going to be able to do these twists. But if you do have an able population, it is a good idea. That way you can add in a couple of different things. The next exercise that I like to do from the seated position is called the sit and reach. Now, what I have them do is I have them sit in their chair. And they take their arms out as far as they can. They're parallel to the floor, and their arms are just an extension of their shoulder. Now keep in mind, you want them to focus on keeping their back directly straight. So our hips and our shoulders maintain a line. My back is straight. So now that I'm in this seated position, my back is straight. I can't emphasize that enough. My arms are directly out in front of me like I'm walking like Frankenstein. While maintaining a straight position, I have them lean as far forward, keeping their arms parallel to the floor as they can before they start to round out their back. Then I have them return to the starting position. This is another really great back extension exercise that gives them a couple of other variations to help with. Also, by holding their arms up and level with the shoulders, level parallel with the floor, it's actually a little bit of a shoulder exercise for them. So it also has a couple of different purposes that you can really give the benefit to your clients. Now that we understand how to have them mobile, what we're going to do, now that we have the understanding of how to keep them stable, we're going to give them a little bit of mobility training so that they're able to move about by themselves. Now here's what we want to do. We want to focus on improving their step length, their stride length, and their cadence. Now keep in mind that stride length is oftentimes the first to go. The example that I just gave with altering their gait with the snow, that's one of the things that they shorten. They're going to shorten their stride length in order to feel more stable as they're walking. They also alter their cadence. Instead of taking those steps, they just more or less move their feet. So having them work with these front and lateral drills to the beat of music or maybe to a metronome will have them help to learn to keep that cadence as opposed to just shuffling back and forth. As you notice, if you look in these pictures, this ladder is made with masking tape. You can utilize the bright colored duct tape, but the reason that this is so important is you want to make sure that you're going with these forward and lateral drills without any tripping hazards. And if you utilize the agility ladder or any type of ladder that has any raise or any rungs, you're increasing their fall risk. So one of the best ways that you can do when working with our elders or our senior population is to make a masking tape or duct tape ladder. Now, as you start to look through, one thing that we want to do is just have them focus on going straight forward. You can have them walking heel to toe, going straight forward. You can have them walking, possibly avoiding a stepping stone, so maybe they have to move left or right, but they're still going in that forward motion with this ladder. Now, going with the lateral drill, what you want to do is to have them go both on the right side and also with the left side lead. So you don't want them to always be focused on the right side or the left side because they're going to develop a side dominance that after a certain point may be irreversible. Our next ladder drill or walking drill is going to be our crossover step. What you want them to do is to step, as you notice, what he's done is he stepped one foot into the square of the ladder and made an altered step back across the ladder. So he's doing an entire crossover. The reason that this is important is because it helps them to understand the weight shift. What we just did in the stability training, now we're going to be putting this weight shift into action. As we have them work with this, again, you want to make sure that you work them on both the right and the left side. So you want them to step with the left foot into the ladder and step the right foot all the way over, and they can do that for one distance. But on the way back, you want them to step with the right foot in the ladder and the left foot crossing all the way over. That way you really make sure you're not adding to their side dominance. This also helps with their agility and their visual acuity. We were just talking a moment ago about having our clients be able to do a U-turn without necessarily having to do the crossover step. What we're wanting to work with on this is having them have a walk and a U-turn both clockwise and counterclockwise. What this will do is to have them prepare for directional changes and also strengthen their hip rotators. Think about how many times your elder population could be out, maybe at a family picnic, and they're walking to the car, and somebody behind them yells something or yells their name. You don't want them to turn around so quickly that they lose balance. So what we want to do is to focus on making these U-turns and helping them be able to turn around and have directional changes so that whenever they have to do it during their daily living and their daily activities, it won't be such a problem. Now, this is one of my all-time favorites, and I think that I may be a little bit biased to it because I live in Chicago. But what you're doing is you're having a piece of tubing, or even the TheraBands, those long flat bands, can work really good. That way there's nothing necessarily cutting into them. But have them walk, and all you're doing is applying a force, a linear force backwards. So as you do this, what you want to make sure that you do is that you keep resistance to the tube, but you don't let them get so far away from you that the resistance pulls them back if they lose their balance. So really make sure that you're doing this with a lot of precaution. It does challenge the core, but here's the reason that I like it so much. Here in Chicago, we are called the Windy City. And even though they tell you it's not because of the wind is horrible here. And if you get stuck in a wind tunnel, literally you're going to feel like you cannot take a step forward. Challenges to your core, such as utilizing this band, are a great way to prepare for that. What's really great is this is something that is able to help them understand how to engage their core, how to move forward, but how to maintain their posture so that they're still supported, which is something that is really, really important. Our next one is our stepping stone drill. Now, what we're focusing on here is having our models be able to avoid obstacles. So as you're working with your client here, they're going to be working. Notice that they have to have a predetermined area to walk, which is what the 2 strips of masking tape are doing. Our picture on the left is our first progression. You notice those are paper plates. The reason that paper plates are really good is because it's not going to really cause much of a tripping hazard. It's something that they're able to compensate with. You can have them do a couple of different things with this drill on the left side. You can have them make sure that they step and their feet have to touch on those paper plates, that every step has to be on a paper plate. That's one way to move through this. Another is to have them step and that they have to take a certain number of steps and they must not touch the paper plate, which is also a really great way to use this. So what they're going to have to do, remember option A is that they have to take a step and their feet can only touch the paper plate, or option B, where they have to walk through there almost in a zigzag pattern without touching any of the plates. It's a great way to help them to understand of how to avoid obstacles. Our picture on the right, what our client is doing is she is going from a stable to an unstable surface. And those inflated discs are offering them the unstable surface. If you think about when people get out and about, nothing is ever perfect. There is always going to be a bump in the sidewalk. Maybe there's a crack and it's raised up. Maybe somebody has spilled a drink. Maybe there's a bag of trash on the sidewalk. There's always going to be something that's going to pose an obstacle. And this picture on the right is something that's really great. The reason that I like them to go is to step up on that unstable surface is think about if somebody ever has to make a step up, they want to make sure that they can stabilize their ankle. And this is something that is really great. Our next one is our range of motion training. And our range of motion training is going to be taking our participants through as much and a complete range of motion as possible. Whenever people start to maybe lose a little bit of the range of motion. Perhaps they're not reaching up as much. They're not having to pull shirts on and off. They're not having to get things off a top shelf. So we want to make sure that we do not lose this range of motion, specifically with our population. The first one that we can utilize is teaching range of motion with paper plates. Now, the reason that we use these paper plates is because they offer great resistance against the air. So if you're holding a plate, like the picture on the left, and you were to bring that all the way up and overhead, that's going to offer a little bit of resistance from the air. The picture on the right is them utilizing the balloons. They may or may not be filled with water. But this offers something that's easy to hold on to. It offers something that's inexpensive for a trainer to use. But the reason it's really easy is it's a really great idea, if they were to lose their grip on that balloon and it fell, it hit them on the head, it's not going to injure them. So that's why these balloons are a really great idea. Utilizing the paper plates, I make sure that my elder population goes through a full arm circle, or some people call them sunshine circles. Start with the arms down below, just relax down to the side, such as in the picture, and have them inhale, bringing their arms all the way up and overhead, touching those two paper plates over the top of their head. Once they're up here, have them inhale and exhale a few times. And then when they're ready, on their next exhale, we're turning those arms down by their sides. It's something that's a really great idea, and it's something that's really helpful to increase that range of motion. Whenever they're doing this, as a trainer, you're going to be able to see really easily who has a limited range of motion. Now the next, working with the balloons, working with the range of motion, say someone has a shoulder impingement. They're not able to get their arms up overhead. What you can do is have them hold that balloon and start out with the balloon down at about chin level. From here, just have them straighten and extend their arms as far up and overhead as they can, but slightly in front. What this is going to do is still be working with our range of motion, but it'll be a little bit more controlled. That way, if they do have any of that shoulder impingement, it's not going to aggravate it or upset it any. Now, these copycat drills are wonderful. If you think about it, you can do these a couple of different ways. One is to work with a Simon Says type of copycat drill so that they're having to do whatever you say. That way, they're having to focus on listening and then commuting that into an actual movement. So that's something that's really great to help with their mental acuity. Now, the copycat drill would be best for working with clients who maybe have a hearing loss. That way, they're still going through a variety of movements, they're mentally engaged, but they're able to use more of a visual instead of the auditory cues. There's a couple of different ways that you can do this. I know it's really fun, and I know it's really funny. It may sound like that's crazy to have these full-grown adults playing Simon Says or doing copycat, but it's something that is really, really helpful with maintaining that engagement. Neck rotations are something that's really interesting. And if you look at some of the different populations and problems that you have, as people get older, a lot of times what happens is they stop driving. And when people stop driving, they stop having to look over their shoulder left and right so much. So what we want to do is we really want to focus on this movement. You want to have them sit up nice and tall in their chair, and really focus on that posture. Remember, posture really helps our respiration. So having them standing up tall, engaging their core, and just slowly taking their head, moving their head as a complete unit so that they don't just turn their eyes. So their eyes have to go with their head and reach as far and look as far back over their shoulder as they can. You can have them do it two ways. Have them do it once where their eyes are open and see how far they actually get. Then do it a second time where they just move their head with their eyes closed. Once they reach as far as they can, have them open their eyes and see if they have the same distance. Have them, that way they'll understand if the tracking makes a difference on how far their neck can rotate. Remember, what you want to do is to want to keep your head up. You don't want to tilt it from left to right or just lean your head back and try to look over your shoulder that way. So you really want to focus these neck rotations all the way over. What you want to do as you're working with these, have them focus on holding that. So once they look over their right shoulder, remember their shoulders have to maintain their front alignment, they can't rotate over. Have them hold that about 10 seconds, possibly working up to as many as 20 seconds. And have them bring it back, and then looking over the next shoulder. And then coming back. There's a couple of different things that you can work with to maintain that mobility in their neck. This one, even though the picture doesn't give you a very good description, what they're doing is they're just simply taking their head over to the left and over to the right. So have them sit in a very tall position, all upright posture, and having them maintain their shoulders at a down and relaxed position. Before I even get started, what I have them do is I sit and shake their shoulders out. So give me one big shrug, their shoulders come all the way up to their ears, and exhale and roll those shoulders down the spine. So that way their shoulder blades go all the way down the spine as low as they can. I have them do that a couple different times. So I have them shrug up, roll the shoulders down the back of the spine. So it's almost like they're sticking their chest out. Slowly coming to that relaxed position. Then I have them do it the opposite way. Inhale with the shoulders coming up to the ears and almost rounding the shoulders forward and rolling them down. This will help relieve any of the tension in their shoulders and the scapular region. Then, when they find out where that relaxed position is, I let them just take a couple of good deep breaths here. From here, then what I have them do is rotate that head over so the ear is going down to the left shoulder, trying to get their head as far down without moving that chin at all. Then have them come up, taking it over to the right side, having them slowly let that ear drape over to that right shoulder. Now remember, the whole time you should be cueing that they maintain that slow, low, relaxed position within their shoulders. No rounding forward, no rounding back, that they just make sure that their shoulders are relaxed and they rotate over from side to side. Now this one is our balloon chest press. You're probably not going to be able to get your client down on the floor, and maybe depending upon the level of frailty, they may not even be able to do the push-ups against the wall. So what we're going to do here is we're going to give them a balloon, and right now these balloons are in this picture are just filled with air. What I like to have my clients do is to give me a nice grounded stance with their feet. So even though they're seated, I want them to have their feet about 10 to 12 inches apart. They have a really good base. And I have them take that balloon and press it straight out. As they start to press this balloon out, there's a couple of different ways that you can do it. You can have them take it out. If they're able and aren't suffering from any osteoporosis, I would have them hold that balloon out and rotate maybe 45 degrees to the left and hold that position. Then come back to the center. Rotate maybe 45 degrees to the right and come back to the center. Then bring the balloon back to the chest. You can have them do this a couple of different ways. Just a straight chest press or have them press and rotate. And then for that additional challenge, you can either give them a playground ball, something like a basketball that's a little bit heavier, or you can put a small amount of water into that balloon so that it does have a little bit of weight to it. Our next option is that balloon shoulder press. Now, as you notice, this is not a true overhead press because we're really trying to be cognizant of their shoulder girdles here. So by keeping that balloon out in front of them a little bit, it's causing less stress and less impingement on these shoulders. So that's something that's really, really important. Again, what we want to do is focus on the breathing. As they are starting to press that balloon over their shoulders, we want them to remember to exhale on the exertion. As you work through this, again, you can have them reach this balloon all the way up and overhead, and if they're able and not suffering from any other conditions prohibiting this, have them rotate over 45 degrees. So this way now the whole torso is rotating with this balloon while it's pressed up in this diagonal position. Not only is it a challenge for the shoulders, but it's also a challenge for the core to maintain that really upright position with the rotation. Now with our chair hip extension and flexion, we can really utilize these exercises in a number of ways. You could have them just do a simple lift. Remember how we talked about that oftentimes our elder population shuffle so they don't bring that knee up, losing some of that hip flexion? You can have them really focus, and while giving them this chair, they're going to feel like they're in a very supported position. So this is one great exercise to work with their extension and flexion. Now here's something that I like to have them do. I'm going to have you actually stand up and do this with me because it'll make the explanation a little bit easier. So once you're able to stand up, have your client holding on to that chair. They're holding onto the chair with their right arm. Then we're going to start with our left leg first. What we're going to have them do is just flex at the hip so that their knee is lifted, like in your picture on your right on your screen. And I'm going to have them hold this. Now, if you notice, the knee just bends a little bit. The leg's about at a 90-degree angle, and their leg is just up. Have them hold it for as long as possible. Or start out slow, have them hold it for 5 seconds and slowly increasing each time. Then I switch, rotate them over, have them do it with the right leg. So now we turned around, so our left hand is holding the chair, and we're going to bring this right leg up. We're going to hold it. First progression, hold it 5 seconds, progressing all the way up to about a 10-second hold in this static position. Then, now we're going to have another progression, and we're going to work our quads a little bit. So while they're holding onto the chair, they were still going to stay on their right side. So my left hand is holding onto the back of the chair. I'm going to bring my right leg up just enough so that my foot is off the ground approximately 6 inches or so, or as few as 3 inches will be fine. What you're going to do is you're going to have them extend the knee out. So now their leg is basically at a full extension, and their heel is approximately 6 to 8 inches off the ground. Have them bend the knee and return the foot to a standing position. Then bend the knee again, extend the leg out, hold, bend the knee, and return to that standing position. Now what we're doing here, in addition to working on the hip flexion and extension, we're also working on some of that quad strength. You can do the same thing with having them work on the hamstring curl, which is something that is really, really beneficial because oftentimes our elder population does not actually work on going up and down stairs. So still working on that flexion extension of the knee for a standing hamstring curl will help to rebuild some of that strength. Now with the seated plantar flexion and dorsiflexion, this is really important. Oftentimes the reason people trip and fall is because they're not picking their feet up. Going back to the Parkinson shuffle, whenever they're just simply moving their feet forward and backwards, this is something that can become really, really beneficial. What you want to do, you want to have them work on just plantar flexing. So basically what they're doing is they're planting their foot in, so they're going up on their toes. If you notice, our person is in a seated position, so there's no risk of them falling, and all they're simply doing is working on elevating their heels by pressing their balls of their feet down. Then what you're going to do is you're going to have them work the opposite side. While keeping their heels on the ground, you want to have them work on bringing their toes up in that dorsiflexion. Now, as they go through this, I like to have them do 10 reps of the plantar flexion. As you notice, as they start to go over, it's going to get a little bit of a stretch in that anterior tibialis. Then I immediately go to the dorsiflexion. As they start to work this, they're going to actually feel a little bit of a burn on the front part of their shins, especially if they're not used to picking their toes up. This is where I oftentimes do what I call the tennis ball trick. If you've ever been with us for the Stretch Yourself Strong or the myo release, you'll probably remember this. But after they work with that dorsiflexion, I let them relax. And I just simply take a tennis ball and very gently roll it down the front of their leg, rolling it down their anterior tibialis to help release some of that tension, because that anterior tibialis is really, really hard to stretch, especially with our elder population. So now, not only are they getting the plantar flexion and dorsiflexion, but they're also getting a little bit of that myofascial release and that trigger point therapy by working with the tennis ball. Now, working with this, especially the dorsiflexion, is going to be really great in helping with fall prevention, because it's really building up the strength on the front part of the lower leg compartment to help them to pick up their toes, to help them be able to be a more efficient walker. Our next one is still working within our ankle region. And this is working within our range of motion. The number one most important thing that we can say about this slide is the seated part. They are seated, and their feet, and oftentimes I like to start with just one foot. So I have my left foot planted firmly on the ground, and I'll put my right foot up on top of that half foam roller. And then I will work in both the inversion and the eversion in order to really work with the range of motion. Now, if you think about it, think about our elder population. Pretty much everything is in one motion. They're going to pretty much walk forward. That's all they do. They rarely are going to do anything that requires them to move side to side. So working with this range of motion on this ankle inverter and everter is going to be really, really important. This is going to help them reduce the risk of injury. Because you're maintaining the range of motion, they're less likely to sprain an ankle or less likely to injure their ankles because of the slightest bit of change on the ground. It also helps them to prepare for walking, and maybe there being a banked surface or a raise in the sidewalk. It's going to help them to understand of how to maintain the stability because they're used to going through this range of motion within it. This is one of the best overall exercises in order to help with their respiration and relaxation. Now, what they're doing from a seated position, they're going to inhale, reaching all the way up and overhead, which is what our man on the left side is doing. So he's inhaled, arms circling up, reaching all the way up and overhead, maybe a slight extension back if they can take it. Then exhale, bringing their arms down by their sides, rolling all the way down into a seated forward fold, like our lady is doing in the picture on the right-hand side. Now, the reason that this is so important is because a lot of times people don't ever really allow their back time to relax. So this gives a good roll down with the back. Also, gives them a chance to allow their head to just hang. So once they're in this forward position, have them relax the neck muscles so the crown of the head points to the ground, or as close as they can get it to the ground, without them having to support the weight. I always go back and laugh about the Jerry Maguire quote, the human head weighs 8 pounds. But it's true, your head is really heavy compared to how big your neck is to support it. So having them be able to roll forward, being able to just release that head and the crown of the head to fall down to take some of the pressure off those, off the spine is something that is really, really beneficial. And it's going to feel amazing. Now, what we're looking here is at our wrist finger range of motion and dexterity. So on the left-hand side, there is a strip of duct tape with small pieces going across it. And on the smaller pieces that are making an intersection, the numbers are 1, 2, 3, 4, and 5. What the person is doing is they are picking up a Coke can and having to turn it over. Now have them grab the can both a couple of different ways. So have them grab a can of Coke how they would normally grab it with their thumb and forefinger pointing up, and have them flip it over. So now the thumb and forefinger are on the bottom. And then have them release. Whenever they go to get the next one, have them grab the next one in that same position. So their thumb and forefinger are on the bottom of the can, and then have them flip it over. That way they get used to moving in both directions to work with that wrist range of motion. Also, by numbering the intersection pieces of the deck tape, 1, 2, 3, 4, and 5, they're having to, I think it actually goes to 6 too now that I look at the picture, but they're having to work with their visual acuity as well. Now our picture on the right-hand side is actually working with the finger dexterity. So you would spread out a variety of change and having them work through picking up maybe only the pennies. And they have to pick up the penny one at a time and place it into the cup. You can have them go through it a couple of different ways. If you want to work on some of their mental acuity and working with their addition, subtraction, tell them that they have to put the coins in to equal 98 cents. So whatever they can get the coins in to equal 98 cents. So just having them go through small tasks in order to work on their dexterity and some of their mental acuity. This is something that's really interesting, and it's something that I laugh whenever I teach the seminar live because oftentimes people don't realize how difficult some of these things are. So what I want you to do is to take your hands and open them nice and wide, like you're almost going to catch a football. What you're going to do is you're going to touch your thumb to your index finger, and then come back wide. Touch your thumb to your middle finger, coming back wide, thumb to ring finger, wide, thumb to pinky, and wide. And have them go through that at different speeds. So you may have them do 1 wide, 2 wide, 3 wide, 4 wide. Then have them slowly increase the speed. So it's going touch, 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 touch. So now, not only are they increasing with the dexterity, but they're also working with opening and closing their hand, which will eventually help with their grip strength. Now our picture on the right is a little bit more challenging. What I want you to do is to take your hands flat down on your desk, or if you don't have a desk, put them flat down on your lap. So since your hands are nice and wide, what I want you to do is I want you to take and I want you to put your index finger as close as you can to your thumb. So you're still going to see that your hand forms about a C. Your index finger and your thumb are going to form the letter C on the left hand and a backward C on the right hand. Then take the middle finger and move it as close as you can get it to your index finger without moving any of the other fingers. Then moving the ring finger closest to the middle finger, and then moving the pinky. You'll notice that one finger is going to have a much larger range of motion than the rest. Now, there's another way to do this. Now what I want you to do is to put your hands flat down, keeping all of your fingers together. We're going to do it backwards. So all of your fingers are as tight together as you can get them, and you're going to move your pinky out first. So all of your fingers together, but now your pinky, you've moved as far away from your hand as you can. Then move the ring finger and try to get it as close to your pinky as possible. Then move the middle finger as closest to the ring finger as you can get, and the index finger as close to the other one. Then move the thumb in the opposite direction. So you're going to see how far you can stretch your thumb away from your hand. There's a couple of different ways that you can work through this finger range of motion and dexterity. Doing this over the webinar is sometimes a challenge, especially because people get distracted about whether or not how well they can move their fingers with their range of motion and dexterity. But it's something that's really great because it helps work within the finer muscles within the hand, focusing on those fine motor skills such as picking up those pennies. Perhaps what if they drop a screw to something and they have to pick up something that's rather small? There's a couple of different ways that you can help to really make sure that they are successful without losing any of that range of motion and dexterity. Our next one is what we're going to call our multiplanar balloon drill. So what you've done is there's a couple things. Basically, you have a balloon that's tied on a string. That way you can have them step on the string. That way the balloon never goes too far, and they don't have to keep getting up and moving if they're maybe not all that mobile. but their goal is to keep that balloon up. So they are going to just simply keep touching the balloon and keeping it up into an area around them. You can make this a group game. So there's a circle, and they're trying to keep the balloon in a circle going around and around. So keep in mind that there's a couple of different ways. What you're wanting them to do is to move in different directions. There's a couple of different ways that you can accomplish this. The reason that string is there or that ribbon is there is that way if they lose the balloon, maybe it gets too far out, they don't fall out of their chair trying to reach it. They can just let it hit the ground, grab the string, and pull it back closer to them. Now, our resistance training is something that is our final progression. And as you start to work with these, you're going to see a couple of different exercises that are going to be really kind of entertaining, because you'll notice as you start to go through these, some of these you realize, wow, I need to work on that. And the first one is the hand dexterity. It's tossing the ball from hand to hand, both high and low, and then from side to side. Now, it may sound simple enough, but you'd be surprised how much your hand-eye coordination diminishes over the amount of time. So our model, what he's doing is he has the ball on his top, and he is just simply dropping it from high down to low. You want a ball that does not have a lot of bounce, because you don't want it to bounce out of their hand before they have the ability to close it. Once they get that high to low, you can have them rotate their hands down and have them toss the ball from left to right. Again, you don't want a ball with a lot of bounce, because you don't want it to bounce out of their hand before they have a chance to close their hand around it. The ball squeeze, think about holding a stress ball and having them work on their grip strength by handing that ball a good squeeze, and then release, and then squeeze and release. Now, on the right-hand side, our newspaper scrunch is something that really focuses on dexterity and the finer muscles within the hand to work on those motor skills. Start with a piece of newspaper wide out and flat. And what they're going to do is they're going to put their hand on it and just simply crumple up by keeping their hand on down. You'll get an elder that's kind of a smart aleck, and they'll just pick up the paper and crumple it up in their hand. But what you want to make sure that you do is their hand stays down on the paper. I've even gotten kind of mean before and made them keep their palm down so they can only work their fingers, which is really difficult to do. You want to give them an additional challenge. Once they've got that paper up into a ball, have them work on flattening the ball back out. It's something that's going to take a lot of time, but it's something that's also really, really kind of funny. It will give them a good laugh at themselves. But it also is something that will really work on those fine motor skills. Now, this is one that we're looking for that's going to be really focusing on their grip strength, which, if you remember, is one of the tests that they do for frailty. And this is the towel twist. So almost as if they're wringing a towel out, like it has water in the towel and they're having to wring that towel out. That's what they're doing here. So as we go through this, it works on both their grip strength, it works on their wrist range of motion. So it's something that has a couple of different ways that you can work with this. What you can do if you want an additional challenge, make them get used to holding a little bit of weight. You can have them soak that towel in water and over a bucket, wring it all the way out. What you want to do is to focus on using both ways to wring it out. If you think, most people are dominant, so they're going to rotate one hand over while pulling the other hand the opposite way. Make sure that you get people to roll both ways. And that's where the picture on the right comes in. There's a small dumbbell. It looks like it's attached for here with a TheraBand to a rod. What they're going to do is they're going to roll hand over hand to roll that TheraBand up so that that weight comes right up next to the dowel rod. Then, once it's rolled all the way up, you're going to reverse it. You're going to unroll that TheraBand so that the weight falls back down to the floor. This is something that works really good, both with grip strength and also increases with that wrist mobility and range of motion. Still focusing on some resistance exercises, This balloon chest squeeze is going to be basically a little bit more of isometric type, but you want to make sure that they continue to breathe through this exercise. So they can utilize something like a balloon that has a little bit of a give, a playground ball that children play dodgeball with that has a foam base to it. You can have them work through things like this, just having that pressed in as hard as they can and really working with engaging their chest and their arms together with this exercise. These exercises that we have here are focused a little bit more on strength training because we're actually using more than just their body weight and balloons. So this is a Dynaband exercise. First, what she's doing on the picture on the left, she is working with a tricep extension. So she is holding the Dynaband or the TheraBand or Dynaband, whichever you have access to, in the left hand. She's going to grab right there close to the hand and just extend her right arm out so her right arm is parallel to the floor, focusing on engaging that tricep muscle. Slowly lower back in and just extend it back out, much how you would do a kickback or a tricep extension. Our exercise on our right is working more of a bicep curl. So what she's doing is she has the band underneath her foot and she's just simply curling that band up. You can utilize the bands that have the handles, the tubing with the handles, whatever works best with you. Now the bow and arrow, what is great about the bow and arrow is it works with a wonderful range of motion. So you would hold the band in both hands, so straighten the band out. You're holding it a little bit more than equal distance. So you want to split the band equally between both hands with about, I would say, 8 to 10 inches between your hands out front of you. Then slowly bring our right elbow into the body like you're cocking back a bow, opening up the chest and the shoulders to the right side of the room, and then returning back to the center. Then you're going to do it on the left side. So you're going to bring the left elbow back to the body like you're pulling back a bow, opening the chest and shoulders up to the left side of the room. So these are a couple of different shoulder exercises, arm exercises, and upper body exercises that you can use with the Dynaband. These are moving into a little bit more advanced, working with the tubing, having a horizontal row. Exercise Etc. sells the door strap so that you can anchor the tubing to a door if you do not have a machine that is readily available, which is what that picture on the right-hand side is utilizing as a door strap. So there's the horizontal row, simply pulling forward, moving our shoulder blades back, our elbows going back to our horizontal row. And our picture on the right is the decline press. There's a couple of different ways that you can utilize tubing within the home. Our sit-to-stand exercises are really beneficial. Specifically, we talked a little bit earlier about how hard toileting can be for our frail elders. There's a couple of different progressions that we like to go through. One, you can have them stand with assistance, either a bar or possibly you giving them your hand to help stabilize and pull themselves up. And then slowly moving into the progression of them having to stand up on their own. I like to make sure that all of our frail elders are able to stand from sit to stand on their own. And that's something that is really, really important. I like for them to be able to do it without having to press off anything, and that does take the progression. One, to get them used of how to put their body, their center of gravity in order to properly stand. Some people have a hard time leaning forward to stand without putting their hands on top of their thighs. So it's definitely a progression that you can work through and you can work with your clients. Our next exercise here works with our knee extension. So working with our quad muscle group and our hamstring. So what's happening on the left is we're going to take the Dynaband and make a loop with it. You can also utilize the circles, the tubing circles that Exercise Etc. sells at most of their conferences. And putting the feet through the tubing, what you're going to do is you're going to just simply extend that left knee. while our right leg stays planted firmly on the ground. Have them hold for a few moments and then return back to start. Do 8 to 10 reps on one side and then switching over to our other one. Our picture on the other side is a little bit more complicated. What you're doing is you're going to tie that Dynaband or TheraBand to the sides, the legs of the chair. And what they're doing is they're just simply basically doing a seated leg curl, pressing back against that band. So it's something that is really easy to do. It works both the quad and the hamstring set within the muscle group. Our next one is our band-resisted plantar flexion. So as we looked a little bit earlier, with them working on plantar flexion of just pressing the foot down onto, this is giving them a little bit of resistance in order to really be able to focus on building up their lower leg compartment muscles. This one is wonderful whenever we're starting to look, specifically with clients that don't maybe have access to our abductor and adductor machines within a gym. They can work within these balloon squeezes. So basically what they're doing is they have the balloon between their thighs or knees and they're squeezing in. Remember, you want to make sure that you have the balloon that's not going to pop out, so make sure that they're aware because you don't want them to bang their legs together. So these are just a nice, slow, and controlled movement to help them work on that adductor muscles. Now, our next, what we're working with is we're increasing our dorsiflexor strength. Our picture on the left, what she's doing is she is juggling the ball back and forth between the instep of her feet. This is working on our dorsiflexion strength. It's also working with our foot-eye coordination, which is really important whenever we start to talk about avoiding obstacles on steps and things like that and walking on sidewalks. The picture on the top right, what she's doing is standing toe lift. So that ball is back there for support. You can also have them lean against a wall if you feel like the ball will be too unsteady. And this is working on utilizing just their own strength while standing there to lift those toes up. This is really important for Parkinson's because that dorsiflexion is what's going to help them release that spasm of that breathing. And then the picture at the lower right side is the tube-resisted dorsiflexion. What our trainer has done is wrapped the tubing around the foot and is holding it down. So they're just dorsiflexing against that resistance. Our next one is our tennis ball side-to-side tap. Same thing that we were just showing you on the previous slide. This is just in a large picture. What our person is doing is basically juggling it like a soccer ball. Just as we did the scrunch with the newspaper with the hands, this is them utilizing the Dynaband to pull in utilizing just their toes. It helps them develop a little bit more of that tactile senses on the bottom of the foot that are oftentimes lost whenever we start to wear shoes so often. Unfortunately, with this one, it's not as easy to undo the scrunching. So once they get it all scrunched up, you may have to have them bend down and lengthen it back out to repeat it. That concludes our exercise with Frail Elder. Again, here's the information on how you're going to get your CE certificate. After you have viewed the complete webinar, make sure that your printer is on. Then log on to our website at exerciseetc. Again, you're going to be looking for that administration tab on the left-hand side. You're going to click Webinar on Demand, complete all the required fields, and then click Submit. Once you have finished everything, your continuing education certificate will appear. And remember, you can either print it or save it to your desktop or email it to yourself to make sure that you have everything. If you have any questions, please feel free to call or email Exercise Extender's home office. Again, my name is April Bolter. Thank you so much for spending these 2 hours with us, and I hope you have a wonderful day.